Hi, hey there, I'm Jenn Rice, and I wanted to talk today. You saw my question, what is at the intersection between conventional medicine, which is pretty much the type of medicine that I always trained under and practiced under, and that is Western medicine, and integrative medicine, which is more, some might call it like Eastern medicine, more of a holistic approach, naturopathic. And really what's at that intersection is something called functional medicine. And I think it was my post announcing that I was doing a fellowship training with a local doctor that I posted last week. And someone said in the comments, by the way, a lot of the comments, so many of them awesome. I hope I answered most of them. But someone asked, what is functional medicine? So I thought it would be great to come on since I've had now all of like 4 full days in a clinic learning about it. I know a little bit more. Obviously, I'm just scratching the surface, but I thought it'd be a good time to share what exactly is functional medicine. And you know, if I'm being honest, I really didn't care what it was, nor did I think I had any need for it. If you had asked me this a year ago this time, I would have said, I don't know, that's probably something some quacks do, or I don't know. I probably wouldn't have been very open-minded about it. I began to follow some people online though, like Dr. Mark Hyman. I also followed Amy Myers, Dr. Amy Myers, who did a lot of through her own personal journey with issues with her thyroid. She's written, books and lectured. So I started to follow these people a little bit and was opening my mind somewhat to it. But it wasn't until I personally became sick. I'm going to just kind of recap real quick for those of you who have never heard this story. I had sort of this irretractable heartburn that started about probably March of last year. And it carried on, and I kept taking medications. You know, we have all the over-the-counter stuff, Zantac. You can buy Prilosec over-the-counter, pretty much anything you need, Tums galore, whatever. I was using all kinds of things, and it was kind of helping, kind of not. By May, I was sleeping pretty much upright, so 2 pillows in the bed, and I was up probably 2 a.m. most days, 2 to 4, just trying to kind of get comfortable. So in June, I landed myself twice in the emergency room from lip swelling, which is angioedema of the lower lip and then the upper lip. And we found that it was due to the medications I was taking for the heartburn, and specifically one, which was a proton pump inhibitor. They're usually called, over the counter, it's called Prilosec, or omeprazole is the prescription drug. And, there are like 40 million Americans with heartburn, so I didn't feel like I was, anything special or like an outlier condition. It didn't really cross my mind to visit a functional medicine doctor or look into other doctors until I was in the emergency room and I was talking with this ER physician, and he had mentioned to me that his wife had also developed this massive allergic reaction to where the back of her throat, like the uvula back there, had swollen so much she actually was panicked and rushed her to the emergency room. And they found it was her proton pump inhibitor medicine, and he said, you need to stop that. And I thought, if I stop this, which I had to, what am I going to do about my symptoms? So he said, well, I would follow up with a GI doctor, which they specialize, in everything that has to do with the gut. Or you could go to allergy immunology. And in my mind, I thought, really? Like, I've worked in specialty medicine. The work we do, yes, it's great work. It's needed by the way our system's set up, but oftentimes we're running a lot of tests. Often there's more medicine behind the tests, and we're not really getting to any kind of root of the problem. And so since I've been following Dr. Myers and Dr. Hyman online a bit, because every time I Googled heartburn, to be honest with you, he would come up, Dr. Mark Hyman, and I would start reading some of his stuff and his natural home remedies about drinking pickle juice and all this kind of stuff. So I was familiar with him, and I kind of liked him, and I thought, well, I wonder if there's anyone in the area I can see. So I went in, and literally I did one visit. I started an elimination diet that went on for 21 days, and by day 3, I was free of heartburn. By a weekend, I was symptom-free and laying flat. And then I just kind of carried on the way of eating, which has proved to be very healthy. It resulted in over 25-pound weight loss. I've come off of all medications. And so, I go through this to say that, so functional medicine is really, it's a science-based, personalized healthcare approach. And what they do is assess and treat underlying causes of illness through individually tailored therapies to restore health and to improve function. So it's really getting into the root cause. And what is the woe? I'm not sure. I'm not sure I understand your question, but that's okay. Type it back in for me if you can. So basically, the primary causes of disease usually come from either one of these following, or it's a combination of all of them. Toxins, allergens, microbes, stress. Stress was a big one for me. Poor diet. I was definitely up there with a pretty poor diet. Oh, way of eating. Sorry. Oh, way of eating was they placed me on a 21-day elimination diet, which was so it was no dairy, no soy, no grains or oats, no wheats, no gluten, no alcohol. Ding, ding. That was a big one. I actually went to the car and had a little cry for all the gin and tonics and margaritas on the rocks with salt and Chardonnay and Merlot because we were breaking up, right? And it was okay though, because to this day, it's about 8 months later, and I don't really miss the alcohol. Maybe I miss the emotions around it, but I don't miss it. So I wonder if I'm missing anything on this. I'll pop in the comments the exact elimination protocol, but that was for 21 days. And then you could go back to adding in like eggs 2-3 times a week, but I actually kind of just stayed on it. I have added eggs back more recently. Okay, so why do I feel like now functional medicine is the future of medicine? And I so much so that I actually left dermatology in November. I sought out a position. Sorry, my dog's down here and she's going to knock this over. Okay. I sought a position which, thank goodness, I was able to secure with the same practice that helped me feel better. And I'm excited to be there. So why does society even need this kind of medicine? I didn't think we needed it until it did so well for me I couldn't help but share it. So basically what we're facing in the United States and probably throughout the world, although not so much in underdeveloped countries, chronic disease seems to be more prevalent in developed countries, and specifically the United States. The increase of chronic disease and what it's predicted to do over the next couple decades is pretty astounding. So we're talking about things like cancer, diabetes, coronary artery disease, heart disease, mental illnesses. That runs the gamut of depression, anxiety, more severe illnesses. Of course, autoimmunes, we can just sort of leave that out there. I can't name all the autoimmunes, but if off the top of my head, anything having to do with the adrenals, the thyroid, certainly rheumatoid arthritis, some of the other autoimmunes like MS, lupus. So I don't want to leave any of them out because they're all equally worth mentioning. But with the rise of these chronic disease, we need a field in medicine that is focused on getting to these root causes rather than covering up with medications or just focused on symptoms. And there's nothing wrong, with the way I was trained and how I've practiced for 13 years, but I am really intrigued and super motivated to learn kind of a new way of doing things with a wider scope of vision, if you will. So, okay, what's another reason why we need this? The current system that we have in healthcare it's designed to take care of acute problems. So you have an acute problem, you come in, I have a rash. We take care of it with a medication, topical medication, whatever that might be. Maybe you come in with a hernia. We're going to move you on to surgery, right? So it's taking care of the problem, taking an immediate action, pharmaceutical-wise or intervention procedure-wise, which absolutely has its place. I mean, let's be honest. If we have a traumatic fall and we need an intervention for a hip replacement, I mean, of course we need that. But functional medicine will be the thing that helps us address this chronic illness, almost epidemic. Another thing that they mention is why we need functional medicine is that there's actually a big gap, almost they say a 50-year gap between research that we have and that we're actually putting into practice when it comes to chronic disease. And I found that pretty astounding. And then the last one, I was trained, and many providers were trained we weren't trained to assess these chronic and sometimes multiple chronic conditions that are happening all at once to a person. So, what functional medicine will do is it will take the patient history, we'll look at the physiology behind what's going on, but there's a lot of focus on talking about lifestyle, a lot of questions about lifestyle, and that helps to kind of lead the clinician to the illness and help get to the root of what's going on. And it's not uncommon to see patients that have multiple chronic illnesses happening all at the same time. For example, maybe someone has high blood pressure, they have diabetes, they also have rheumatoid arthritis. So there's 3 things going on at once that are chronic diseases, and that's a lot of things to put together for someone, right? So what I think is we're actually we're taking kind of the best of both things. So I don't think it's like we're throwing out everything. I'm throwing out everything I learned the last 13 years. No. And I'm not saying that anything's wrong with the way anyone's practicing conventional medicine, but there is a better option especially if someone has a chronic condition or they're looking to prevent those things from coming. So other things that they do in functional medicine, they talk a lot about the patient's exercise, like what they're doing for exercise. They also use the latest laboratory testings to test for certain things like metals, toxins. Certainly when it comes to Lyme and some of the more complicated conditions like Lyme, there are some specific labs that you want to use that aren't always accessible to every practice. There are kind of certain labs will be doing more specified testing. And then the prescriptions range from like regular prescription medicine, like we hear about all the time, like antibiotics, antifungals, to botanicals that have those properties. I mean, we know that a lot of the medicines we have today come from plant and botanical sources anyhow, right? So that makes sense. Supplements, therapeutic diets like the one I was on, detox programs, which can be helpful, so detoxifying someone's system, and then stress management, which I never really paid that much attention to till I really started studying functional medicine. The amount of emphasis that's put on stress management is really, I think, so important, because if we're not managing our stress well, and I see you guys jumping on, thanks so much for being here tonight. If we don't manage our stress well, that just kind of keeps that almost like it's like a feedback cycle, just keeps going and keeps going. And in my current, a group of us are doing a challenge right now. It's a 14-day challenge. It's called Health Seekers, Intro to Anti-Inflammatory Lifestyle. And we're 8 days in right now, the group of us that are in there. And we're talking a lot about different ways of coping with stress, but we're also bringing in topics that are basically with the 6 pillars of well-being, and one of those is sleep. So we've been doing a lot of talking about, kind of auditing your sleep and making sure that you're being mindful of how much sleep you're really getting. So those kind of things are talked about in clinic in a functional medicine office, which maybe don't always get brought up all the time otherwise. And so, I wanted to share with you guys, there's basically 10 reasons why you should maybe consider seeing a functional medicine provider, and you may or may not have one in your area, I can certainly provide a reference of where you could look someone up. But one reason is, like I alluded to earlier, which is just your own, having your own relationship with a provider that's maybe a little bit deeper than one that you have with your current, primary care physician. And if you have a great relationship with them, then absolutely bring up some of the topics that we talk about from time to time here, because I'm sure they'd be open to hearing it. But a lot of times what I hear from patients is that they feel like they're just a number, just a number, like it's a cattle call, right? And this tends to be more one-on-one, a little bit. Obviously the appointments are longer, and oftentimes they're not covered by insurance. Most people have to pay initially out of pocket, and then they can be reimbursed on the back end. And perhaps this will be changing over time. I could see it would be. But that's, one reason to do it. Another reason is, say you're feeling pretty well, but you want to reach your full potential, feel better. Maybe you have some lingering fatigue that no matter what you seem to do, doesn't seem to be getting better. Or perhaps you've already seen, your OBGYN, or, hey, I'll even use, your dermatology provider, and you feel like something's just kind of lingering, and you want to kind of get a different set of eyes on it. That's another reason. And I actually have 8 other reasons, and I'm happy if you're interested in, getting the full list of 10, I can definitely send those to you. If you want to send me a private message, I can send those out to you. And if you like this content, when I go live, if you hit the, I think it's like a subscribe or something like that, you can catch me live. And I really appreciate you guys being here tonight. And I hope that, my message was of value. I hope I at least answered the question of what the heck is functional medicine, and what does it have to do with us. And I think I was pretty transparent in saying that I would have said, who cares? I don't know. But at some point, sometimes things happen, and it's either to you or someone that you love, and you find that you need some more answers, or you just need a different approach at things. And this is definitely what could be that for you or that family member. So if you guys ever have any questions, feel free to reach out to me too. And I hope you have a great, great night. Take care.